Welcome to the first video in our Women's Health series. This one's all about endometriosis. Endometriosis is characterised by your uterine lining, the stuff that normally forms your period once a month, instead of being inside the uterus, being outside the uterus, normally somewhere in the abdomen, wrapped around a bladder, around your bowels, God knows where. How it gets there is still under a lot of debate. The whole of endometriosis, there's a lot of unknowns, not sures, hypotheticals, maybes. In fact, recently evidence has actually suggested that the endometriosis, so the ectopic endometrial tissue, isn't in fact even endometrial tissue. It just looks a bit like the endometrial lining. So who knows where it comes from and what it is at the moment, unfortunately. Like I said, a lot of what ifs, who knows, maybes. Hopefully in this video, I will try and get through some of the evidence, some of the research, some of the science behind it all and explain it as scientifically but as simply as possible, so you get an understanding of what endometriosis is and how it affects the body and why there's so many different variables that can all be associated with it. So around 10% of women of reproductive age are thought to have endometriosis. Studies on twin populations have found that heritability is approximately 50%. And looking at genome studies, there is a link between certain gene mutations and the person getting endometriosis. So you can either inherit these gene mutations or these gene mutations can just spontaneously occur. Before we talk more about endometriosis, let's quickly talk about the menstrual cycle, very, very quickly. Every cycle should consist of endometrial lining growth, which is facilitated by estrogen, which is supplied by your ovaries. If the lining is no longer needed because the egg isn't fertilised, then your body will shed that endometrial lining, and that's what forms your period. Seriously, guys, there should be a better way to have done this. One of the main substances that stimulates the lining to be shed is a substance that's normally part of inflammation. It's called prostaglandin. This causes the uterus to contract, and it also breaks apart the endometrial lining so it can be released downwards. Prostaglandins being in an area also a part of the reason why if you have inflammation, it hurts. They essentially bring the pain. In endometriosis, as we've said, for one reason or other, the endometrial lining attaches itself outside of the areas of the uterus. They grow with the help of estrogen and then with the help of prostaglandins break down. Funnily enough, the main symptom that women with endometriosis complain of is supremely painful periods. Now, obviously, you can get painful periods without having endometriosis. In fact, 50% of women of reproductive age will suffer from painful periods, or very painful periods, which is a term called dysmenorrhea. The main finding with dysmenorrhea is that sufferers tend to have elevated levels of prostaglandins in their system. Therefore, they get more uterus contractions and more sensitivity to pain. So now with endometriosis, not only have you got the endometrial tissue in your uterus potentially releasing prostaglandins and becoming painful, you've also got the ectopic endometrial tissue outside, attached to your gut, attached to your bladder, also potentially releasing off prostaglandins and becoming painful, which is why pain is one of the big issues, because there's just so many different areas that can potentially cause inflammation and pain. However, studies also show that a lot of women are actually asymptomatic. So obviously this level of prostaglandins may not be elevated in some women who have endometriosis yet have no symptoms. In fact, 50% of women who go for fertility treatment are actually found to have endometriosis and don't even realise because they're completely asymptomatic. So this partially explains the pain side. However, if you talk to someone who has endo or read about it, there also seems to be another lot of symptoms, associated symptoms that accompany endometriosis. Before I talk about these, what I need to look at with you is a few other hormonal stroke neuronal pathways, which I do geek out about this. I do find this stuff super interesting. Bear with me if you're not finding it so super interesting. It will be extremely relevant as we go on. First of all, we're going to look at how the effects of stress are on the body, because time and time again we're told that stress is bad for us. However, without stress, life would be pretty boring. However, prolonged stress and high levels of stress definitely affect our body in adverse ways. But some people, the stress affects them just that much more than other people. The first stress response we're going to talk about is the autonomic nervous system, or the ANS. It's a system that's regulated by the hypothalamus, which is an area in the brain, and it's comprised of your sympathetic nervous system, or your fight and flight reaction, and your parasympathetic nervous system, which is also known as your feed and breed or rest and digest part of the nervous system. You can see from their names what each side is more like, and this illustration gives you an idea of what each side will do within the body. The sympathetic nervous system is activated in the presence of a stressor, and the parasympathetic nervous system is more active when we're actually chilling and relaxing or doing something pleasurable and enjoyable. Your default mode should be your parasympathetic nervous system, and the more you're in that zone, the stronger it becomes, the more you build up its integrity. It's almost like a muscle being built up. The sympathetic nervous system should be active for short periods of time in response to a stressor. Could be a physical, could be a mental stressor. However, it was designed originally more for physical stressors than mental stressors. Just our lifestyles probably have evolved more for it to be a mental set-off as opposed to a physical one now. So what other mechanisms do we have within the body that control inflammation? This takes us on to our second stress response, the HPA-axis, the hypothalamus, sending a signal to the pituitary gland, which sends a signal to the adrenals, which release off the substance cortisol. Okay, cortisol has a big control over inflammation, but it also is responsible for giving us or mobilizing our energy. We always have a baseline amount of cortisol regardless of stress or anything like that because of this important function with energy. So in the morning when we wake up and we jump out of bed, our cortisol levels peak up to their highest, so we jump out of bed with energy, ready to face the day. And then as the day goes on, that cortisol level slowly diminishes down further and further till the end of the day where we're feeling quite tired, less energy, obviously we're not quite jumping around as much normally. And then in the evening and during the night when we're asleep, our cortisol levels are at their lowest. In response to a stressor, the sympathetic nervous system kicks off first, and then about 10 seconds later, the HPA-axis then activates. This is important that the two mechanisms are linked, they work together. The sympathetic nervous system is, as we said, inflammatory, whereas cortisol, which is the end product of the HPA-axis, is actually anti-inflammatory, so it reduces inflammation. So these two systems work together so that, again, your inflammatory levels aren't too high. So cortisol can help reduce the pain of menstruation from prostaglandins and substances like that. The other thing that's important about cortisol and the HPA-axis is it self-regulates. So if you get too stressed and your cortisol levels rise quite a lot, it actually inhibits itself. It has a negative feedback loop. So the cortisol sends signals back to the hypothalamus and the pituitary that stops them working and calms down that stress response. So you feel a little bit more chilled again. I promise you, this is the last brain bit. You're doing well. This one is called the HPO-axis. 10 points if you can guess where it starts. Of course, 10 points if you've guessed hypothalamus. So it's the hypothalamus to the pituitary to the ovaries, and subsequently estrogen is released. Now there is a reciprocal link between the HPA and the HPO-axis. So activation of one will affect the other. So linking these systems with those findings of endometriosis. Endo is often referred to as an estrogen-dependent disorder, generally being associated with higher levels of estrogen. And remember, the higher levels of estrogen generally mean higher levels of endometrial tissue, which can potentially mean more prostaglandins being released from that endometrial tissue, so higher levels potentially of inflammation. There is also found to be a dysregulation in the autonomic nervous system, leading to an increase in inflammation and therefore increased levels of pain. Also, because of this local altered response of the autonomic nervous system and increased inflammation, it actually encourages more of the free-floating endometrial tissue fragments, shall we say, to latch on outside into the abdominal cavity area as opposed to the uterus, causing more endometriotic lesions occurring. Lots of studies have shown that women with endometriosis have lower cortisol levels, and this results in poorer control of inflammation generally, amongst other things. So why do some women get endo and others don't? Remember we said that there was genetic mutations that you can inherit through your DNA that are found in a lot of people with endo. Some of these changes mean that the HPA-axis, the HPO-axis and the autonomic nervous system are more susceptible to these changes that I've just described that are found in endometriosis. So essentially you can inherit a nervous system that is susceptible to becoming overactive and subsequently dysfunctional. Some studies have also shown that if your mother's HPA-axis was more active while she was pregnant with you, this can actually affect the resilience of the developing fetus's HPA-axis, so making it more susceptible to these changes. The other factor that can affect it is chronic stress, including early life stresses. This can influence the functioning of the HPA-axis. So if you have an HPA-axis that is either easy to activate because of genetics or because it has a lot of long-term stresses, chronic stresses, initially you'll have a HPA-axis that is very active and you'll be producing lots and lots of cortisol. However, this system isn't designed to be switched on at high levels for long periods of time. It's designed to be switched on for short periods and then go off again. It's meant to be a very acute system. So if it's chronically activated, it decides that this isn't healthy for the person and actually it kind of shuts it off. It essentially shrinks your adrenal gland, making it less good at producing cortisol in the first place. Fun fact, as you get older, your adrenal gland essentially shrinks anyway, so your resilience to stresses gets less as you get older anyway. And remember we talked about that negative feedback loop where the higher levels of cortisol actually switch off or calm down the HPA-axis or your stress response, making you feel calmer. Remember, if your cortisol levels can't go up because your adrenal glands can't produce cortisol as well, it doesn't switch off the HPA-axis. So essentially you feel stressed for longer without having that relief. So these dysfunctions in the nervous system can result in many of the other symptoms that endo sufferers will describe. Low cortisol levels mean low energy. If we look at this graph, we can see on one side this is a healthy person with no conditions. This is the normal average baseline cortisol levels. On the other side, this is someone, or the average of people that's suffering with endometriosis. Can you see how it doesn't peak as high in the morning, which means you're less likely to wake up with energy and feel refreshed, and generally is lower throughout the day. So you're just going to feel a bit more sluggish and a bit lacking in energy. Because of the negative feedback loop not working as effectively, i.e. higher levels of cortisol levels switching off or turning down that HPA-axis, the stress response remains switched on for longer and at higher levels than someone whose cortisol will naturally increase and calm down that stress response. This can leave you feeling that wired but tired sensation, so essentially feeling stressed and on edge, like you need to do something but not having the energy to do it. Cortisol is also helpful in consolidating memories, also known as learning. So brain fog, which is quite a common symptom of endo, is where you feel like nothing's going into your brain, not remembering why you walked into a room or go up the stairs. These sensations with low cortisol levels can be a lot more prominent. And as we've said, inflammation is not controlled as well, which means generally your pain levels will be higher throughout your body. pain will be more sensitised as inflammation will lower your pain threshold. It sensitises nerves. Basically, anything that could hurt will hurt, and it will hurt at higher levels. You might notice also other inflammatory-based symptoms becoming a problem, things such as allergies or skin rashes or sinus problems and things like that. Moving on to the autonomic nervous system dysfunctions that can be found in endometriosis. The parasympathetic nervous system controls our appetite, so appetite changes can be an issue. It also controls digesting food. It stimulates saliva, which obviously helps process the food. It helps food move correctly from the stomach down through the intestines and releases bile to help effectively break down fats. IBS is a disease characterised by alterations in the autonomic nervous system, and they often find that they have a reduced parasympathetic nervous system and a relative increase in the sympathetic nervous system. A reduced parasympathetic nervous system is also found in people suffering with short duration sleep insomnia. Being able to be in a parasympathetic state means being able to switch off and relax and go to sleep, and also just relaxing without your mind racing at 1,000,000 miles an hour, or being able to concentrate on the task in hand without your mind wandering off to another 10 different tasks that you're thinking about at the same time. From the name Feed and Breed, and almost a general knowledge that stress can impair female fertility via alteration of the autonomic nervous system, I assumed there'd be quite a lot linking dysfunction of the autonomic nervous system and female infertility. However, when I actually looked for the evidence, it was surprisingly, or unsurprisingly, super sparse. And actually there was loads about male infertility, despite typing in female infertility. Time and time again I was getting research articles about blocked fallopian tubes or poor egg reserves, but actually not a lot of research about altered autonomic nervous system or reduced parasympathetic tone and female infertility. So although we assume that there is one, we can't 100% back this up with evidence quite yet. The last symptom I'm going to mention is bloating, which does seem to be pretty severe with people with endometriosis, and a lot of people will complain about this. Again, not fantastically researched, I'm afraid. So I'm going to link together the autonomic nervous system changes in digestion that can cause bloating, alongside the fact that there's going to be possibly loads of endometrial tissue inside your abdomen, which is releasing off inflammation, so swelling. So between the two, you can kind of see where the bloating side comes from and why it can be so severe. So the primary finding with women with endometriosis, symptomatic endometriosis, is dysfunction in the stress and hormonal systems, which are controlled by the hypothalamus. Whether this dysfunction is due to genetics, early life stresses, or chronic life stresses, or a mix or all of the above, is individual to that person. These findings feature a lot in many chronic problems, such as fibromyalgia, in chronic fatigue syndrome, in ME, in depression. The main difference with endometriosis is the link with estrogen, so increased levels of estrogen, and also the fact that that woman has endometrial tissue outside of her uterus, generally in the abdominal cavity. If the person could have endometrial tissue outside their uterus, but they haven't got the dysfunction with the hypothalamus and the stress responses, they may never know about that ectopic endometrial tissue, and therefore never know that they have endometriosis, which is where these asymptomatic people may come from. The only way to diagnose endometriosis properly is to open you up and take a look. So what treatments are available to people who have got endometriosis? First one I'm going to talk about is surgery. Obviously surgery, the aim is to reduce or kind of remove as much ectopic endometrial tissue from inside the abdominal cavity where it shouldn't be. Now obviously this is mostly structural in treatment nature, so if it's wrapped around your bowel and it's impairing the bowel function because of the structural changes, it may well help with the bowel functioning. It may also overall reduce the inflammation that's being released inside the abdominal cavity from the ectopic endometrial tissue as well. However, it won't change your hormone or your stress reactions. So a lot of the associated symptoms will still be present. The other thing it won't do, or it will do, is produce a lot more inflammation. It's a surgery at the end of the day. So you will produce more inflammation post-surgery, which you will have to deal with. So if your inflammation is already high, you will have more inflammation as a result of the surgery. So you may feel pretty rough post-surgically. With any types of surgery, discuss all of this with your doctor, risks versus benefits, to see if surgery is an option for you. The other thing is that if you have got quite an inflammatory system that is going haywire still, even after the surgery, you may well produce more ectopic endometrial tissue, so chances are it could well come back. Painkillers can be prescribed. Normally these will be non-steroidal anti-inflammatory medication, or known as NSAIDs. These are medications that inhibit the production of inflammation, such as prostaglandins. These are pills such as naproxen or ibuprofen. The problem obviously with any medication is that they have side effects, and the one with NSAIDs is that they do have a strong effect on the stomach, which is why your doctor will quite often prescribe a stomach liner such as omeprazole to go alongside it. Or if not, make sure you don't eat the pills on an empty stomach. Eat them. The other thing is that you shouldn't take these because of the side effects for too long, because of an accumulative effect of taking them over a long period of time. So the best way to use them is to try and treat acute flare-ups of pain. So if you're having a very inflammatory phase, they can be used in the short term to help control the pain if it becomes an issue where it's affecting quality of life too much. Contraceptive pills are quite often prescribed to help with the dysmenorrhea pain associated with endometriosis. Again, I stupidly assumed that there would be lots of evidence to support this, as it is a common practice and has been used for years. However, I've got to stop being stupid because, again, startlingly lack of evidence for contraceptive pills for endometriosis. Some of the evidence, suggested it actually was no better than placebo. However, the theory kind of makes sense. By controlling the amounts of estrogen you produce, you control the thickness or the amount of lining that you produce, which should technically help with the endometrial pattern pain. However, again, it is just treating the end result, not the cause, by just kind of controlling the end amount of endometriosis, not the reason why it's there in the first place. And again, a lot of the other symptoms aren't going to be touched by just using contraception. Now let's talk about how you can help yourselves, because let's face it, that's probably going to end up the main thing that is going to work for you, finding the things that work for yourself. So what I'm going to do is explain to you why certain things can work, what you can do. Unfortunately, we are seriously now going into the realms of lack of evidence. So this is me cobbling together kind of experience, whatever evidence I can find, and the scientific theories behind things to try and explain how they work and how you can incorporate them into a self-care regime. Okay, before you start any self-management strategy, you really need to be in the right headspace. I've spoken to so many women who know what they should be doing or trying to do, but just aren't in the right headspace. It's never going to work if you're not there. You really need to have the motivation, and you need to identify if you have ongoing stressors that's going to keep causing you a barrier to implementing these strategies. Okay, so I'm working towards a diet, and having exercise and counselling or implementing therapies may work a bit, but the changes are going to be short-lived and unsustainable if, one, you still have loads of stressors hitting your nervous system all the time. Two, you don't have loads of time to really give it a go. And three, you aren't in the right frame of mind to give it a shot. So believe it or not, there's actually been a study about this. Basically saying that the reason that women with endo don't partake in strategies to help reduce their problem, or the symptoms from their problem, is because, one, they're a bit burdensome. They potentially can cost a little bit of money. Mixing a bit of skepticism and the fear of what they're implementing, making it worse, kind of is a bit of a recipe for maybe I won't bother at the moment. So you really have got to be in the right headspace. And the issue is the symptoms are probably quite bad because at the moment stress levels are high because you've got a lot on your plate, busy, your stress response is very active, so everything feels worse than it is. So it can feel impossible to find time. So job one, find time for yourself. You're important, and by putting it off, it's going to get slowly worse and harder to get started. So find that time for yourself. You've got to prioritise yourself. And I know sometimes that's hard, particularly women. We sometimes find that hard to prioritise ourselves depending on our kind of life situation. Do what women do best. Organise. Plan a time in your week where you have got time for yourself, okay? Even if it's just half an hour, a couple of times a week, make that time. Try and make it a habit, make it a routine. Apparently, if you keep with something as a routine for at least 2 weeks, it does become a habit and it becomes easier to keep going with, okay? So hopefully you've found that little bit of time for yourself. Try and limit the stressors that you've got smacking into your system all the time. Say no to people. You know, you don't have to say yes to everything. Like I said, prioritise yourself. Say no if you really don't have the capacity to take on more load. Right, hopefully you found some time. Let's find out what you can do with it. Okay, so I'm going to start with diet. I'm going to keep it simple here. I get loads of questions from clients asking about completely random and weird foods and supplements, and generally I have absolutely no idea about them. So there are some simple basic rules to follow if you have any chronic stress related disorder, including endometriosis, which are always going to be helpful. So I'm going to explain to you why and what they are. The first one is sugar. Sugar has been shown to inhibit the HPA-axis. Remember that stress response we talked about? So you temporarily reduce your stress levels, feel nice and calm, but that's why you will start to crave it and it becomes addictive because the feeling is nice. However, do you remember when we talked about the negative feedback loop? So by reducing the HPA-axis, you reduce the amount of cortisol that's released off anyway. So obviously if you have low cortisol levels, that's not great. And then the low cortisol levels then don't work to inhibit the HPA-axis even more. So in the long run, actually it makes your stress response even worse, which is why you then crave it even more because it's the only thing that will calm it down. So you've got to calm the sugar down. Try and cut it out as much as possible. It is hard, trust me. Easter holidays, sugar abundance. I tried to go cold turkey afterwards. It was hard, but do what you can. There is some evidence also to support that trans fats, which are a certain type of fats, increases the incidence of endometriosis because it will activate the inflammatory response further. This type of fat is found in things like fried foods such as fried chicken, French fries, donuts, and as well as foods such as chocolate and margarine and biscuits. It feels like I'm basically telling you to stop eating anything nice. But yeah, trans fats, cut those out as well. The only other evidence that I found to support helping endometriosis symptoms is by reducing caffeine. So caffeine has been shown in higher quantities to increase the estrogen amounts in women, therefore increasing endometrial tissue production, which obviously can be a problem with endometriosis. So I'm no dietitian, and I'm sure access to a trained dietitian, particularly if you can find one with an interest in women's health, will be beneficial. But just by following these 3 fairly simple, in theory, techniques, hopefully that will help with some of the symptoms that you've got associated with endometriosis. Now, as a physio, I would love to sit here and tell you that there is a shed load of evidence to support exercise to help with endometriosis. But guess what? There isn't. However, there is a fair amount of research that supports exercise in chronic conditions involving inflammation. So exercise can help increasing anti-inflammatory substances such as cytokines. We know that. And we also know that exercise increases the production of endorphins, and endorphins are your body's natural painkillers. So again, they can help with the pain size, and endorphins always make you feel a bit better. So exercise theoretically is good. Some of the more inconclusive studies did highlight the fact that some women with endo who were exercising found that the exercises could become painful, and it was more the discomfort that prevented them from exercising further. So filling in the gaps, exercise has been shown to be beneficial with inflammatory diseases, with conditions such as burnout where cortisol levels are impaired. So technically it should be helpful with endo. But when you are exercising, try and find something that you don't find horrific, not only in terms of enjoyability, but also in terms of aggravating the symptoms. And you may need to moderate your exercises depending on your symptoms at the time. So if you're menstruating, having a flare-up, choose an exercise that's a lot more gentle, or even just calm the exercises down in the worst stages altogether. Try and build up exercises gradually, that you're working at a level where hopefully you're getting a bit out of breath, a little bit sweaty, and try and slowly improve and increase the intensity. But take your time, because obviously with symptoms going up and down all the time, you may find it hard to kind of work out what level to begin with. Greater intensity exercise on the whole does tend to show greater benefits with inflammatory problems. So yeah, try and work at a level that you are a bit out of breath and sweaty, but moderate it depending on your kind of level of discomfort at the time. I hope that makes sense. So anxiety and depression are often features linked with endometriosis due to the effects that have been had on the stress response that we talked about earlier. Counselling again has weak evidence, I'm afraid, but it has been shown to help, certainly with the anxiety side, a little bit less so with the depression side. Some studies looking into the effects on CBT have shown that people with lower cortisol levels respond less strongly than those with normal cortisol levels. However, but those who it does work for, they will get benefit, and cortisol levels can be significantly improved upon. So that's all good. It probably takes us back to the point being in the right state of mind and kind of reducing your stresses before you start the counselling. Again, if you're having lots of counselling, CBT, and you've still got loads of stresses going on at the same time, it's going to have more of a limited effect. So like I said, try and get yourself in the right frame of mind, limit your stresses, maybe try working on maybe a bit of diet and exercise as well, and maybe the CBT will have a better effect than if you don't do all of those kind of pre-treatment interventions. Relaxation, in essence, means being able to activate your parasympathetic nervous system, that feed and breathe, rest and digest side of your autonomic nervous system. And as I've said, those people with endometriosis tend to have a weaker parasympathetic nervous system. This is the reason why the fight or flight reaction becomes more prominent, more overactive. So before you get to this level of parasympathetic nervous activity, you need to start with the simple stuff. Think of the parasympathetic nervous system as a muscle. So the weaker the muscle is, the smaller the weights. This is where mindfulness techniques can become quite helpful. To begin with, it's not about clearing your mind and kind of invoking Zen states. It's actually just about living in the now, okay? It's about getting out of your head. So go for a walk, leave the phone at home, look at the sky, look at the trees, appreciate the green leaves, smell the fresh air, listen to the birds. Like I said, concentrate on what's around you and living in the now rather than having your head going through lists in your brain or constantly on your phone. If you eat something, try and just eat. Don't multitask. Don't sit in front of the TV or again with the phone on the side, trying to do multiple things at once. Appreciate the food that you're eating. Go through what the taste feels like. What does the texture feel like? Actually think about what you're eating. How many of us actually do that? Research supports that engaging in a mindfulness-based program can improve the balance of the autonomic nervous system and reduce the feelings of stress and anxiety. although you must be motivated and find time to do it and be in the right headspace. Otherwise it becomes another stressor that you beat yourself up with because you haven't got time to do, or find time, or feel bad because you haven't done it. Maybe just begin with reading about it and having a little research about the best ways that you can implement it, and then start with small achievable goals, just doing it to begin with where you can until it becomes, again, a habit. This is where I do have to limit myself time-wise, because I could talk about acupuncture for hours. Out of all the alternative treatments, acupuncture has got a reasonable body of evidence behind it, and it has got some scientific understanding as to how it works. Now, albeit the evidence base isn't the strongest, mainly because, one, there's not a lot of money behind researching alternative therapies, so quite often it's just people doing a dissertation or studies off their own back. And these areas of medicine are very much about patient-based treatments, which are very poor to put into a study. It's very hard to control the factors of these type of treatments. However, that is one of the massive strengths of these treatments, is that it treats the individual and not necessarily just the symptoms. It treats the underlying problems. So they're not well-suited studies, but there are some studies, or quite a few studies for acupuncture, that do support it, even if the evidence technically is not the strongest. A meta-analysis of lots of different treatments, including acupuncture, electrotherapy, exercise and yoga, showed that they all had positive trends at improving endometriosis symptoms, but with acupuncture being the only one that demonstrated significant improvement in the pain symptoms. Acupuncture uses fine needles to stimulate different points in the body, thereby inducing a sensory input into the body. Locally, this improves blood flow to the area and induces potentially a healing response. But it also stimulates through the nervous system, invoking responses like endorphin release, which helps reduce the pain pathways, and it also stimulates different areas of the brain. Now, one of these areas that can be stimulated through acupuncture is the hypothalamus, and we know that acupuncture, through studies, can alter the HPA-axis, the HPO-axis, and the autonomic nervous system. The strength of acupuncture and Chinese medicine is that it treats the individual and the underlying cause of the symptoms, not just the symptoms itself. And like I said, it's so individualised to each person, so no two people will get the exact same treatment. In the UK, the NICE guidelines have recently reintroduced acupuncture as part of the NHS service within chronic pain. So depending on your local service, you may be able to access it via the NHS, although it will be under the chronic pain service and not the women's health service, so it might be a little bit tricky. It also is a problem because not many workers within the NHS, therapists, doctors, nurses, are trained up in acupuncture, so it is very limited, which leads to the problem with alternate therapies being cost. A self-treatment modality which has got evidence to support it is a TENS machine. These machines are not too expensive and are easily applied and used. They deliver a tingling type sensation between two pads that you can stick on your body, and the nerve stimulation encourages the body to release off endorphins, which reduces the transmission of the signal through the nervous system from the exterior nervous system across through to the spine, so it kind of blocks that pain signal there. So less signal goes up to your brain, so the sensation appears less painful. Essentially, it's a pain signal blocker. A lot of women use it when they're having a pain flare-up or during that time of month to help with the cramping pains. So if you do want to use the TENS machine for pain control, if you put the pads around here and here, somewhere between the 10th thoracic vertebra and the 2nd lumbar vertebra, that will supply the nerves that are innervating the uterus, so that's where the pain should be inhibited. Easy to put in, as long as you can feel around your back, no problem. Plug yourself in, turn up the volume, and off you go. So thank you for watching this video. I hope either as a healthcare professional or a sufferer of endometriosis you've gained something from this. I'm going to continue to try and help promote and educate on complex women's health conditions. So off I go back into the research abyss to work on the next one.